patient or a practitioner, whether you're a patient or a practitioner, FSM is an incredible tool for all of the problems that patients and physicians have in medicine. So let's go on. Jeez Louise. First, I want to tell you about the new book that just came out. It's called The Resonance Effect. It's a story of how FSM was developed. It's a book for consumers and patients as well as physicians. The reviews have been great. I had a great time writing it. And when I read it now, it's almost like somebody else wrote it. It's really a fun story. The title of the book is The Resonance Effect. You can get it on Amazon.com, or you can buy a signed copy at our website, frequencyspecific.com/book. So what most people want to know about frequency specific microcurrent is where the frequencies came from. Can you hear me or not?
I can't hear you, but I can see
okay.
When you talk, it's showing that you're talking.
So the frequencies were developed in the early 1900s, probably from about 1908, and used by thousands of physicians until 1934. Harry Van Gelder was an osteopath who bought a practice in 1946. It came with a machine and a list of frequencies that were created in 1922. In 1934, the American Medical Association finally cracked down and said any medical physicians who used electromagnetic therapies and frequencies would lose their license to practice, which at that time was granted by the AMA. So the machines went in the back room, got covered up by a sheet, and some of them went on the trash heap. Most of them got lost when Grandpa died, or Dr. Grandpa passed away. And all of the research that went into developing the frequencies, the communications between the physicians and researchers who developed the frequencies, shared them, and who helped create that list in 1922, all that information's gone. You know, they were on bookshelves and in libraries, and when the AMA declared that it was quack medicine, they were destroyed, lost, passed on when that generation of physicians passed away. The list of frequencies was resurrected in 1995 when Dr. George Douglas got the list from Dr. Van Gelder in 1981, and George gave it to me in 1995 when I started practice. Went to chiropractic college when I was 42, graduated when I was 47, and George got me a precision microcurrent 2-channel machine when I first started practice in 1994, and we started using the list to treat patients in 1995. Started using the frequencies for myofascial trigger points, myofascial pain in 1996, and had such tremendous outcomes that we decided I had to teach it in 1997, and that was January of 97 was the first class. So I started teaching it because I wanted to find out if the outcomes we had were reproducible. I kept teaching it because once we knew they were reproducible, it would be immoral not to teach them. So in answer to the question that everybody always has, I have no idea how the frequencies were derived. We don't know where they came from. I don't know if it was tapping or channeling or dowsing or clinical experience, or we just have no idea. Mechanism of action we have some ideas about. We're going to talk about that a little later in the program. The 1990s, 1920s equipment was not microcurrent. It was plug-in-the-wall devices. When these electromagnetic devices were powered by DC current, and the wall current in 1920 was direct current, basically like a big battery. that kind of current stopped being used when Westinghouse won, and we had AC current as the power of the day. So that's where the frequencies come from. Let's talk about how we use them and what they're good for. Basically, the old problems in medicine are how do you heal injuries, how do you repair from surgery, and how do you heal wounds. Healing takes time. The healing is uncertain. Sometimes it's slow. Pain is a problem. Inflammation is a problem. Just rate of repair is a problem. So what limits repair in most patients is ATP production, just energy production in the cells. How much blood supply can you make to take care of or create blood supply to the new and repair tissue? How do you make that new tissue elastic or stretchy, and how do you make it solid? Okay, those are the limitations: collagen, elastin, blood vessels, and basic energy supplies. So what would happen to healing if you didn't have to worry about ATP production or energy supplies? Microcurrent, the basic science behind microcurrent, has been shown to increase ATP production by 500% as long as the current is below 500 microamps. The first study was done by Nak Cheng in 1982. The effect of electric currents on ATP generation, protein synthesis, and membrane transport in rat skin. He found that current levels between 10 and 500 microamps increased ATP production by 500%, increased protein synthesis by 70%, increased amino acid transport by 40%, and that would increase the rate of healing. Seegers repeated those studies in 2001 and 2002 and found that not only did it increase ATP production, that is, not only did micro-amperage current below 500 microamps increase ATP production by 500%, it also increased cyclic AMP in human lymphocytes, and that's in vivo, so these are living cells. And when you increase cyclic AMP, that's evidence that the Krebs cycle is being increased and that the cell is increasing its energy supply and metabolism. And then Seegers also found that the current by itself, this is unmodulated current, activates signal transduction. So how is current, microcurrent, produced? Well, microcurrent is produced by microcurrent devices. The devices are approved in the category of TENS devices. TENS are prescription, but the current is 1,000 times less than TENS. So it's approved by the FDA in the category of TENS, but it's millionths of an amp, not thousandths of an amp, so it's not TENS. Non-prescription use is by estheticians and over-the-counter for microcurrent, but it's the difference between prescription and non-prescription is claims made. Non-prescription devices are for facelifts and skincare treatments. Prescription devices or TENS devices are for pain management. Microcurrent devices available on the market very widely. They're direct current or pulse DC current. The waveforms are square waves, sine waves, ramp square waves, H waves. There's all kinds of waveforms. There are one-channel devices, there are two-channel devices, there are combined units that have ultrasound, interferential, galvanic, and microcurrent. Those combined units only use 0.3 of a hertz. And then generally, the frequency is not important. It's a limited number of frequencies or a sweep of frequencies. So there's a device out there that just sweeps from 1 to 1,000 and back again, and then the machine reads resistance and then just pauses on a single frequency for a while. So those are the devices. That's how you get micro-amperage current that increases ATP production. Then they did a study at University of Washington. It was done on rabbits, biopsies. So they biopsy the bunnies, Then they treated the bunnies for 20 days, so 4 weeks, 5 days a week. Is what you get a graduate student to do. And then they rebiopsied the bunnies, and what they found was that the blood supply to the rabbit skin increased by 39%. That's like a 40% increase in blood supply. Collagen increased by 14%, which is nice. But elastin increased by 48%. Elastin is what makes repair tissues stretchy, normal, functional. So these three findings are really profound when you start applying them or extrapolating them to healing of wounds. And then you have to ask what would happen to injury and wound healing outcomes if you could increase ATP production, blood supply, collagen, and elastin. The frequency effect, well, if you could increase ATP production, vascularity, blood supply, collagen, and elastin, wound healing would increase dramatically and profoundly. But that doesn't say anything about the frequencies. What we found is that the frequency effect makes a huge difference in frequencies. Just unmodulated microcurrent increases ATP production, but the frequencies add a dimension to healing that is profound. We did one, thanks to Denise Curtis in Ireland, we did one control trial in 2009. It was published in 2010. And this is called the late onset muscle soreness. It's the kind of muscle pain that you get after you've worked out and done eccentric contractions of the muscles hard enough to make your muscles really sore. So this compared frequency specific microcurrent to a 1999 study done by Allen that compared single channel microcurrent, 0.3 hertz and 30 hertz for 20 minutes. Allen also used 200 microamps, and the negative trial refers to the fact that it didn't work. Basically, you exercise the patient immediately after the exercise. You apply 0.3 hertz for 10 minutes, 30 hertz for 10 minutes, 200 microamps, and there was no difference between the treated and the untreated groups or legs. With FSM, the frequencies were used were 18 and 62 to stop bleeding, to treat 124 to treat the tissue for tissue disruption or being torn, small micro tears in the tissue, inflammation in general, and then inflammation in the muscle belly, the fascia, and the tendon, and then vitality in the muscle belly, the fascia, and the tendon. So these were the frequencies that were used. The treatment time was the same, 20 minutes. The current level was the same, 200 microamps. But here's the difference. The treated leg, well, the sham leg, when you exercise like crazy and you know you're going to be sore the next day your pain level is a 5. And this was placebo. This machine was not turned on. This machine was turned on. Pain in the untreated leg was a 5 out of 10. Treated leg was a 1 out of 10. At 48 hours, you're more sore the second day than you are the first day. 48 hours, pain level was a 7 in the sham leg or the placebo leg, 1.2 in the treated leg, and at 72 hours, the pain level in the untreated or placebo leg was a 4, and the treated leg was 0.7 or less than a 1. So the p-value is a measure of statistical significance. So even though I think there were only 10 or 20, I think there were 20 people in the trial, the p-value has 3 zeros, which is huge statistical significance. Anything over 0.05 is acceptable, and by the time you get to 3 zeros, it's profound. The thing about delayed onset muscle soreness is there is no other effective treatment. What this means in the real world is that people that lift weights for a living or play football for a living, those people can exercise like crazy and not be sore the next day, so they can exercise the next day too. It also means that when they play in a game and get minor or even medium-sized injuries, that the increase in ATP production, the increase in collagen and elastin allows those injuries to heal more quickly. We've got units with probably 6 or 8 NFL teams, NHL teams, 1 Major League Baseball team, and probably 200 and some odd professional players in different sports and Olympic athletes, and some military folks. So the use of FSM in treating new injuries is really profound. Now, if you take those injuries and you make them into a surgical event, John Cale did this study in 2013. It's still unpublished, but the data is good. He did C-sections on patients, and because he's an OB-GYN, and the FSM group had their hospital stay shortened to 2.9 days, so 3 days. It's about a third of a day. They get out of the hospital about a half a day to a full day earlier than patients who were not treated. So he took all of his FSM-treated patients. He had the hospital find patients with the same surgery who were not treated with FSM, and that is your control group. They were standard of care nursing and physical therapy treatment. Reducing post-op pain was exceptional. With activity, pain in an untreated group was a 5, and an FSM group it was 2.7. Pain in an untreated group was a 1.8 at rest and a 0.5, like less than a 1 at rest. So reducing pain and shortening hospital stays in a fairly simple surgery like a C-section is extraordinary. When you expand that kind of wound healing to include diabetic wounds, this patient had a 7-centimeter wound on his left leg, and that was healed in 9 days. If you see here, it says July of 10, 2000 to July 10th, and then July 19th. This wound on the left side of his leg is healed skin to skin. His second toe was necrotic, and they were basically waiting for it to get worse before they amputated it, waiting to see if the left foot was going to get any worse so they could take both toes off at the same time. So the necrosis in the second toe was resolved in 12 treatments in 6 weeks. The necrosis in the third toe was resolved in 7 treatments in 6 weeks. Peripheral neuropathy is just numbness and pain in the feet that bothers diabetics, is quite uncomfortable, limits their ability to walk, and increases the likelihood that they're going to fall. And sensation was completely restored and pain eliminated in basically 4 weeks. So that's 8 treatments over 4 weeks period. So that's how FSM helps with wound healing. So there's some other old problems in medicine. Inflammation is at the source of every degenerative disease. Somebody raised a hand. Inflammation, degenerative diseases, and immune system activation. We treat those, or medicine treats those, with anti-inflammatory drugs. These days, people will treat them with curcumin or there's another herb. Anyway, natural anti-inflammatories. And the problem with even prescription anti-inflammatories is they take too long. Too many side effects. You block prostaglandins, and you block all the prostaglandins. You block the prostaglandins that help rebuild your stomach lining and rebuild blood vessels. So it creates too many side effects. And cytokines, which are an inflammatory peptide, medically speaking, are very hard to change, and the drugs that change them drop them below the normal range. So you have side effects like cancer and infections. So medicine has problems treating inflammation. Okay, So here's the question. What would happen to this problem if you could reduce lipoxygenase inflammation by 62% in 4 minutes? COX-mediated inflammation by 30% in 4 minutes. And that's what we did with some very specific frequencies. This study was done in Australia in 2003. It was published or presented in 2004. It was blinded animal research. It didn't start out blinded, but they did the first 10 animals with 40 hertz on channel A and 116 hertz on channel B. And you paint arachidonic acid on the mouse's ears, and that makes the mouse's ears swell in a very predictable fashion, and then you measure it mechanically. So this is a fairly low-tech, inexpensive type of experiment that they could do in the veterinary science department at the University of Sydney. Vivian Reeve is the researcher, and Wayne Riley was the naturopath who helped her with that research. Anyway, so they ran 40 and 116 on the mice, and there's Wayne grabbing the mice by the tail and the scruff of the neck and just running that frequency through the mouse. And what happened was the inflammation or swelling in the mouse's ears was reduced by 70%. Well, that caused Vivian to shut down the lab, because in 18 years of doing research on anti-inflammatory prescription drugs, she had never tested any prescription or non-prescription drug that reduced inflammation by more than 45%. So they blinded everybody in the lab, which means they moved everybody into separate rooms. The person who was painting the mice went into one room, got the door closed, painting the mice with arachidonic acid on their ears. Moved the person that was measuring the mice went into a separate room and got the door closed, so he couldn't see who was treated, who was untreated. And the person who was, the response was there at 2 minutes. The full response was there at 4 minutes. So then they did, they wanted to find out, we wanted to find out if any other frequency would reduce inflammation. So they did 1/10 of a hertz, which was just enough to move the current. So would the current reduce swelling? And the answer was no. There was no reduction in swelling. 4 minutes of the frequency are frequencies. So would any other frequency besides 40 hertz reduce swelling? And the answer is no. 2, 3 other frequencies were tried, nothing else reduced inflammation. Same thing with the intermediate injury protocol, no reduction in swelling. And then we even tried 40 hertz on channel A and the frequency for the skin on channel B, and there was no reduction in swelling. So here's one that was just fascinating to me. It's a little more complicated. So sunburn causes you to swell. Right? If you've ever had a sunburn, you know that your skin gets really red and inflamed and puffy and it's really sore. So here's the group of mice. They sunburn the mice. I know, about this point I start feeling sorry for the mice, but back to work. So they expose the mice to UV light, like you get sitting out on the beach in Hawaii for an hour and a half or 2 hours and just forgetting to put on sunscreen. So the mouse's ears swelled this much, and then they had one group of mice that were treated immediately after the burn, and their ears, there was no significant reduction in swelling. There was a group of mice that were treated at 2 hours, and they had a statistically significant reduction in swelling, 0.05 and 0.01. So here's the other thing about sunburn. Sunburn suppresses immune response. And this one is a little complicated, but if you stick with me, it's really quite extraordinary. They paint a contact sensitizing agent on the hind leg at the time of the sunburn. So this is something that you should develop an allergic reaction to. So they paint it on the hind leg, and then 2 weeks later, the same agent, stuff, was painted on the mouse's ears, and a normal response in a mouse that has not been sunburned is that the ear should swell, okay? So here's the group that was not sunburned. That's a normal response, 30 probably micrometers of swelling in that group of untreated mice. Here's the sunburned mouse group, and their swelling was reduced by 63%. So the sunburn suppressed immune response by 63%. The group that was treated at 2 hours, remember the group that had the 0.05 statistically significant reduction in swelling, 0.01. That group had their reaction to oxazolone, or this sensitizing chemical, reduced from 63 to 57%. So that's good. So the immunosuppression was reduced by the microcurrent that was applied at 2 hours. The group that got microcurrent immediately did not have a statistically significant reduction in swelling, if you remember, and but that group had their immune suppression reduced by half 2 weeks after a single 4-minute application of one and only one frequency pair. That is absolutely intriguing. So it says that those two frequencies, 40 hertz on channel A, 116 hertz on channel B, can affect the immune system more or less permanently and create changes in inflammation. So what are the implications? If you're a patient or if you're a practitioner, what are the implications? What they were studying in the mouse group was lipoxygenase, LOX and COX, cyclooxygenase inflammation associated with all degenerative conditions. So asthma, COPD or emphysema, irritable bowel, Crohn's, pancreatitis, ulcerative colitis, liver disease, rheumatoid arthritis, and degenerative arthritis. The difference is that when you take medications for this kind of inflammation, they suppress these prostaglandins for 12 to 24 hours. They suppress them and keep them down. Those prostaglandins are good for other things, like rebuilding your stomach lining and rebuilding the inside of your blood vessels. With FSM, the frequency 40 hertz on channel A and anything on channel B slams the inflammation down by 62% or 30%, but it only keeps it down for about 6 hours. When the cells come back, however, to normal function, they never seem to produce as much inflammation as they did before. This is the immune system cell 2 weeks after a single application of this frequency. So the application of the frequencies appears to change cell signaling, change the way the immune system functions. So even though the LOX and COX, the prostaglandins, are only reduced for 6 to 8 hours, when they come back, they come back at normal levels or more normal levels. So it's an extraordinary advance in the treatment of all degenerative diseases and all inflammatory diseases. So there's another set of inflammatory peptides or chemicals associated with inflammatory diseases, and those are called cytokines. They're peptides that are present and mediate inflammation inside the body. So do a Grand Rounds presentation at NIH in 2000. At the end of the presentation, I said, we've done this 25 times. They come in with their pain at a 7, they leave with their pain at a 4 or 1, and nobody's going to believe it, basically. So they come in at a 7, they leave at a 1, and unless we get something objective that we can measure, nobody's going to believe that we just did this. So I need somebody to help me measure something. Well, Terry Phillips came up and he said, I'll send you some blotter paper, you send me some spots of blood, and I'll tell you what's changing. So why is this fibromyalgia protocol relevant? Well, there's 28% of fibromyalgia patients in the U.S. So there's 6 million fibromyalgia patients in the U.S. 28% of them, or 2 million at minimum fibromyalgia patients, have their fibromyalgia from spine trauma. And what we found starting, 18 years ago now, there was one frequency combination that would take your pain down, basically eliminate your pain. 40 hertz on channel A, 10 hertz on channel B. Out of the how many patients do we have? 54 patients. 58% of them, or almost 60% of them, recovered. The recovery is individualized. Once you get the pain down, you still have to keep the pain down. They need physical therapy, reconditioning, supplements, irritable bowel, they've got adrenal dysfunction, they've got interstitial cystitis. So once you get their pain down, they still need to recover from fibromyalgia, but getting the pain down is the essential part. Unless you can get the pain down, everything else is like rearranging the deck chairs on the Titanic. So I called this patient and that we had been unable to help in 1998. She came in 2000, and we got some blood samples, and she responded pretty normally. So when I got the blood work back from Terry, interleukin-1, which is a cytokine that's particularly associated with inflammation in the nervous system, which in this case is the spinal cord, but you could imagine it including the brain, so all neurodegenerative diseases. Interleukin-1 went from 392 down to 21 in that first patient, and as a group, they went from 330 down to 80. So this is a huge, unheard of, unprecedented decrease in inflammation in the nervous system. Cytokines medically are hard to change. They're very bunched, except for this patient that didn't respond with the normally because of the spinal cord compression. So all of the cytokines changed. CGRP, interleukin-8, they all went down. These are the ones that were published. Substance P is produced in the spinal cord, goes out in the bloodstream, and it went down by a factor of more than 10 times. So these are extraordinary changes. Beta endorphins go up, went up from 5 to 88 or 8, so by about a factor of about 10 times. Endorphins are what make you floaty when you run, and you have to run a pretty long way to get this kind of increase in endorphins. These patients are so floaty, it's like an induced euphoria. They get sort of stoned. And it's a temporary phenomenon. Once you stop treating them, they get better. I mean, they come back to normal awareness and they're safe to drive and navigate, but it's really an interesting experience. We jokingly say it's legal in all 50 states and we don't charge extra for it, just part of the service. Cortisol goes up, but it's not a stress response because it follows neuropeptide Y, which goes down. Neuropeptide Y follows the sympathetic nervous system. Cortisol goes up, and what we found was that it's a side effect of endorphins going up, because when the endorphins go up, you also raise ACTH, adrenal stimulating factor, and that'll make the cortisol go up. So it's not a stress response, it's a side effect of getting so stoned because you're changing the function of the spinal cord. Pain goes down from an average of a 7.3 to a 1.3. That p-value has 3 zeros, and if you recall, anything more than 0.05 is statistically significant. Well, this p-value actually has 6 zeros. It is virtually impossible in a medical setting to reduce pain from 7.3 to a 1.3 in 90 minutes. So the results, all the patients experienced pain relief. 58% of them experienced resolution of fibromyalgia within 4 months, and then 13 of the 53 discontinued treatment for reasons not related to treatment side effects. And I think actually that it's because if your pain's been a 7 for 14 years and it goes to a 0 in 90 minutes, at the end of 90 minutes you have an existential crisis. It's sort of unprecedented in medicine. But for whatever reason, there was a group that discontinued treatment before recovery. This patient was more typical, 18 years, chronic fibromyalgia. She had 14 of 18 tender points in December, 11 of 18 tender points tender to less than 4 pounds per square inch in January, and by February she did not meet the diagnostic criteria to have fibromyalgia, so she recovered in effectively 8 weeks. The average is 12 weeks. Cervical range of motion improved. Pain medication was reduced. He would take 1 or 2 a week instead of 4 a day. Muscle relaxants were reduced by 95%. Sleeping well with no medication. Digestion improved, and her IBS resolved. 6-year follow-up, she had maintained her recovery and was still doing well. So that's pretty extraordinary. So functional medicine is the modern approach for old problems in medicine. It uses nutritional support and an understanding of physiology and biochemistry and the interconnection of your body's systems. They call it a systems biology approach. And they look at the causes of illness. So in a functional medicine paradigm, if you're treating asthma, you have to go back and treat the gut, because asthma is a result of the immune system going haywire, and 85% of your immune system is clustered around your digestive system. So if you want to fix the asthma, you have to treat the gut, fix the gut, that fixes the immune system, and that usually works to relieve the asthma. Well, there's some problems with functional medicine, and that is basically it takes too long and it costs too much. They talk about getting extraordinary outcomes in 12 to 14 months, and in general, insurance may or may not cover those costs. So the supplements, the dietary restrictions, even some of the medication, and the time it takes just cost too much. So it is an extraordinary program, but Frequency Specific Microcurrent works immediately to reduce the pain, increase ATP to energy, and reduce inflammation. FSM works immediately, but it needs functional medicine to create lasting and stable improvements. So what functional medicine approaches can do in 12 to 14 months, Frequency Specific Microcurrent can do in 6 to 12 weeks. We just haven't ever had a problem with it. Irritable bowel, Crohn's, even asthma, in 6 to 12 weeks, most patients are what they would think of as recovered or 80% improved. It's an extraordinary advancement in even the functional medicine approach. Old problems in medicine: nerve pain, muscle pain, scar tissue. Those of you that have pain issues know that nerve pain and muscle pain are hard to treat. Scar tissue, you can sit there and mash on it for years, and it's very hard to remodel. In general, treatment is either difficult or impossible, takes too long, costs too much, and doesn't work very well. So treating neuropathic pain in the medical world involves medications that make you kind of, stupid. They interfere with cognitive function, is the medical way to say it. They make you kind of slow mentally, because most of them are anti-seizure medications. And nerve pain in an FSM community is one of the easiest things we treat. When I left full-time practice, I went back and went through my charts, and we collected 20 charts of patients who had nerve pain, 7 years of nerve pain from nerve traction injuries or disc injuries. And what we found was that all patients experienced pain reduction. The first treatment, they went from an average of a 7 to an average of a 2. The second treatment, they came in at a 5. So they went up from a 2 to a 5, but they didn't go back to a 7. Second treatment, they went from a 5 to less than a 1, and most of them stayed that way. So it was 2 to 3 sessions. As an average, this 20 patients, 65% of them fully recovered in 5 treatments over 6 to 8 weeks. No adverse reactions except that one where we talked about they get kind of stoned. And what's interesting is all of them had pain reduction. All of them experienced pain reduction. 25% terminated care prior to recovery. So it's too far to drive. It was inconvenient or whatever, but it's the first time in 7 years they've been out of pain, and 25% still terminated care prior to recovery. So not sure what that's about. That's my clinic. Took 6 visits in 6 weeks to get their pain level down from a 7 to a 1.5. So incredibly powerful, a non-invasive, you can't feel it, it doesn't hurt. It's probably the most comfortable way to get myofascial trigger points treated that anybody's ever seen. It's quite extraordinary. I did burn center project using the frequencies to dissolve scar tissue and mature burns. These are patients who've been burned any place from 2 years to 14 years earlier. And out of the 8 patients, 1 patient discontinued treatment after 1 session because we doubled the range of motion in his hip, and he said, what's going to happen to my work comp settlement if you fix my hip if you increase my range of motion to normal? So he had 1 treatment and then come back. The other 7 patients were not work comp cases, and they all had statistically significant and permanent increases in range of motion after 3 1-hour treatments. So what we found is that the frequencies to dissolve scar tissue are quite extraordinary, even in burn patients who are notoriously difficult to treat. This was abdominal adhesion research that I did down at Baylor Medical School with David Weissman. 50, well, you don't need to know the frequencies, but I tried 4 of them. And then there was this 1 frequency that I got to that I didn't expect would do anything. 13 hertz on channel A and 77 hertz on channel B, and we're sitting there looking at this white, hard adhesion that looks like cartilage. Dr. Wiseman's got forceps on the rat cecum, and this white, hard adhesion starts turning clear like coconut oil melting, like it's melting, and then it just turned to snot, basically. It liquefied. And we were stunned, surprised, pleased, opened up the second rat, did the same thing. I ran other frequencies, and they didn't work. As soon as we got to 13 hertz on channel A and 77 hertz on channel B, the white, hard, cartilaginous adhesion turned clear and just resembled snot, liquid. It was amazing. What this means is patients with abdominal adhesions and pelvic pain respond extraordinarily well. If you have an FSM practitioner and you have or know somebody that has abdominal adhesions and pelvic pain, FSM is incredibly effective at reducing the pain because, number 1, it can reduce the inflammation, but number 2, it can dissolve the adhesions. It is extraordinary. All 3 rats, that 1 frequency liquefied the adhesion. It's amazing. When you combine FSM with manual therapy, you get extraordinary results in athletes. This is Kim Pittis. She teaches the FSM. So obviously, for us, Frequency Specific Microcurrent is the new tool. So the frequencies, once again, don't know how they were developed or when, but they've been in use since probably 1914. Our list was created in 1922. And on that list, there are frequencies that reduce inflammation. That frequency reduces pain, but doesn't do anything for range of motion. Frequency for fibrosis or scarring dissolves the scar tissue, increases the range of motion, doesn't do anything for pain, redness, or swelling because it doesn't do anything for inflammation. It just treats scarring. Frequency to stop hemorrhage, stops bleeding and pain in the menses, and prevents bruising in new injuries, but isn't good for anything else. So post-operative patients don't bruise. It's kind of extraordinary. Mineral ion deposits, soften tissue, reduce pain, some changes in range of motion. Frequency for shingles or herpes is only good for that. Reduces the pain. In the prodrome, it prevents the lesions from breaking out. If the lesions have already appeared in the first 2 to 3 weeks, it'll eliminate the lesions in 24 to 48 hours and eliminate the pain. Frequency for kidney stone pain has been effective in every case, but it's not useful for any other condition. It's the only thing it's good for. So the frequency-specific effect is quite extraordinary. We have papers published in the area of shingles. This was an 85-year-old man that had shingles in the ophthalmic branch of 5 on the right side of his head. And 4 hours of treatment, he was pain-free in 1 hour, no return of pain. The lesions were gone in 48 hours. He was 85. The reason this case could be published as a single case report is that ophthalmic branch of 5 shingles in an 85-year-old man doesn't get better. It's what they die of, or it's what they die with. So this case is extraordinary, and it exemplifies what we're able to do with shingles. So how do these frequencies change conditions and tissues? Well, it's a little bit of physics, but it's relatively pain-free. The human body, the short version is, it's a quantum biological system. Living tissue is biochemicals. Okay. Biochemicals are made up of molecules, atoms, subatomic particles that are held together by electromagnetic bonds. Every bond, mechanical or chemical, has a frequency at which it resonates. So when the singer sings a note that breaks the lead crystal glass, that's because she hits and holds the frequency that holds the lead atoms together. Your body is effectively an electromagnetic system that looks solid, but the cells function as a semiconductor network that conveys current, charge, and information. Basically, the water in your body is organized on a matrix inside every cell, on the outside of every cell. And that water, the water molecules flicker in such a way that they turn your body effectively into a big computer chip. All the information on the current that runs your body runs by way of these semiconductor water matrix cells. There are receptors on every cell that are sensitive to signaling. So the membrane protein receptors determine cell function, and the receptors reconfigure in response to some stimuli. So if a little piece of bacteria comes along, a little fragment from a bacterial cell comes along and lands on a receptor in one of your immune system cells, it causes that receptor to change its configuration. That makes it tug on these, kinases. They're enzymes inside the cell. They get signaled to turn on. The kinases turn on transcription factors that change genetic expression. And when you change genetic expression in an immune system cell in response to a bacteria, that immune system cell turns on pro-inflammatory cytokines. What happens with microcurrent, with the frequencies, 40 and 116, just it's available on Amazon, it is very, it tells the FSM story very effectively. FSM is most effectively taught in a 3-day seminar. It's actually going to be 4 days by this September. So if you are a practitioner or you have a practitioner, this seminar has 2 practical sessions a day where you actually get your hands on patients and machines and treat each other and learn how to use this incredibly powerful technique. Because FSM, this tool, is a new tool that solves virtually all of the old problems in medicine. Go to the website, www.frequencyspecific.com, for more information, for published papers, for case reports, and the frequently asked questions, and links to seminars and equipment. So basically, be prepared. Frequency-specific microcurrent will change your life, whether you're a practitioner or a patient. If you're a practitioner, it will change your practice, and it will change your outcomes forever. Go to www.frequencyspecific.com and join the resonance revolution. We'll talk to you next month. Thanks for joining us. Bye.